house anyway, to go ahead and give us our introduction and take the first session. Over to you.
Good morning, everybody. Good morning. So thank you very much. It's a privilege to be here once again. I just thank God for, this another opportunity. Welcome to everybody who has given up a couple of hours this morning to be here. God bless you. Yes, so it's our concluding session. I'll try not to say too much today so that we can have plenty of time for questions. I think it's more. I think I would like it to be quite more like a practical thing, because this is a practical issue. But I'll just use some slides. Obviously from my previous talk. Buki, can you please scroll to slide 12 for me, please? We all know, I think we're fairly conversant with the issue of the menopause, what it is. We've been here before. So I will just 2 minutes just talk about, just recap. We know what, that there are a few definitions: the perimenopause, premature, early menopause, induced menopause. Is just terms just to say, obviously we know that the menopause is when you have your last and final period. We say you've had that if you've not had 12 months of a bleed back to back, and that some people, before they get to that point, it can take a few years and they can still have symptoms. We call that the perimenopause. If you have that under the age of 45, we say it's early, so between 40 and 45. If you have it because you've had some kind of treatment, some kind of surgery at any age, and your ovaries stopped working, we say it's induced menopause. So basically what it just means is that the ovaries are not working, with all the resultant effects that we all get. It's a huge burden. About 30 million in the UK, and it's got obviously a huge impact socioeconomically, personally, friends, family, because we know that the symptoms can be quite dramatic, and be quite can affect people personally, which then leads to people struggling in work, obviously, which can be a huge issue, which is why the government has prioritized women's health, so that we can keep women in work and they're not limited because of their symptoms, and obviously personally what women might be going through and how that can affect their personal relationships and their friends. Thank you. Other relationships. Thank you. So I'll hone in on the symptoms basically. So I've grouped them into psychological symptoms, to cognitive symptoms, physical symptoms, and urogynecological symptoms. So the psychological symptoms, obviously, like we said, during the menopause, women go through a roller coaster of hormone changes, which then results in psychological symptoms like their mood being, having mood swings. They can have, they can be fearful, they can be irritable, they can be very tearful. They just get to a point they don't know why they feel like crying. They start crying. They have fits of rage. I've seen women who that really quite affected their work as an anesthetic. She was a pediatric anesthetic, and she just found out that she had rage. And you don't need rage when you're trying to anesthetize a baby. So she quickly ran to the menopause clinic. So yeah, and her symptoms helped, settled. So just feeling down and sad and having, no drive, depressed. For people who have experienced maybe mood problems around the birth of their baby, postnatal depression, are more likely to experience mood symptoms around the menopause, because it's their hormones that is changing again, and that people who also have a background of anxiety and depression, not necessarily around postnatal, can also have a heightening of their symptoms when their hormones begin to change. Obviously cognitive symptoms, but basically by that I just mean, so it's problems with your memory, so memory loss, short-term memory loss. And this is a big thing for a lot of working women, because this is the time this begins to happen, is coincides with when you're beginning to rise in your career. Maybe you're a CEO, you're an accountant, you have a responsibility, and then you have work to do, and then you can't remember. You're in the middle of a meeting, you're saying something, you just veer off, can't remember your last word. Quite embarrassing for people. I've seen people, this is a main issue for them, and this is the reason they will come and ask for treatment, because they just feel they are not on their form. They are not performing as they should because of this memory lapses, word finding difficulties. You can move to the next slide, please, at the cognitive, please. Sorry, Buki. So they struggle with what is so called, what people call brain fog. So It's like they are there, but their brain is just, they just tell you that, I just can't, it's not moving. It's like it's a brain block. And they say, oh, they're having a senior moment, or something like that. And then again, it's the mental tiredness, because maybe they've had hot flushes overnight and they didn't sleep. There's also the hot flushes can keep them awake. The night sweats can keep them awake. Even if they don't have that, they can just have insomnia. So they sleep and they just wake up, eyes open, no particular reason, can't sleep again. They wake up in the morning, they're tired, they have to go to work, they have a family to manage, maybe their kids are sort of adolescent. That's an issue for them. So they can be quite stressed, and that fuels the irritability. They can be angry, or they just withdraw. And all of this is just hormonal changes that is driving it. And then because of that, they don't concentrate that well. It's affecting their performance. And all of this can be quite some women can find it debilitating. I've seen women, because of symptoms, they just had to resign. They were a teacher, couldn't remember the name of the pupils in the class, and the kids were young, big impact on their job, didn't make them happy there. They just felt, you know what, I think I will take early retirement because I cannot manage this. And then physically as well, we do know about obviously is the joint pains, is the aches. So some people will say, oh, their whole body is aching. They are they don't feel some people start to put on weight. Again, they try, maybe they're not able to shift it, it becomes an issue. They have problems with their, obviously, because of confidence. And people mention this, I have all this abdominal fat, I cannot shift it. Bookie, please move to the next slide. I can't shift it. It's a huge issue for them, depending on how people, how weight is, it can be a major issue. Again, fueling mental health. There are people who say they use the word fat, and because of that, it's depressing them. They don't want to go out of the house. It just worsens everything. They can have obviously so the hair, we know that women hair is the glory of a woman. You're losing your hair, is thinning. We know what women go through just to make their hair look nice. That is an issue. The skin is dry, they just don't feel as beautiful. And it can be an issue for them. They obviously, because of I've mentioned the hot flushes and night sweats, also day sweats, and again palpitations. So actually the heart just feels like it's racing all the time. And because of that, they can get panicky, they can feel anxious, they have chest tightness. So these are physical symptoms that you can imagine if all of a sudden a woman is a CEO and she has a hot flush, and because of that, she feels, oh, she gets embarrassed quickly, and then she gets into panic, and then, she and then she feels tearful, and then she has to leave the meeting, and or she has to, leave her work at that particular point. And it's a huge issue. So it's all these physical symptoms that then sort of begin to impact our relationships in terms of how do we then how do we manage it, and how what impact is this having so for example, for the purpose of this talk, on your relationships. You can move to the next slide. And before we get to that, yes, the urogynecological symptoms as well, which I'll talk as I'm talking about relationships. So gynecology, we know issues about the female organs down below, dryness, burning, pain. The drive is completely gone. You can imagine feeling anxious and all the physical symptoms. And then obviously there's zero drive. So there's no arousal, there's no and there's no arousal, there's no pleasure. We know that is something that is meant to, obviously physical intimacy in marriage is meant to be pleasurable, but it's not pleasurable because it's painful, because it's it hurts. It's just something completely different. So because of that, it just dampens the whole arousal cascade. And the bladder, I've seen women who unfortunately do have a lot of bladder symptoms. They're always sort of leaking, and they have to they've converted to not being able to wear just ordinary knickers. They have to wear protection all the time, and it's all the time. You can imagine the impact that has in terms of embarrassment, in terms of even being ready and available, because there's something there, or they might be bleeding and the bleeding hasn't stopped for 2 weeks because you have flow problems as well. It hasn't stopped, so there's even no chance that any sort of action under the sheets can happen. So that has an impact on your relationship. So it brings us to that impact. Basically, I just thought it would be good to just look at the symptoms once more so that we understand, because a lot of the time, people who have had significant problems within their relationship is all down to they say they don't understand. My spouse doesn't understand. And there are some partners or some spouses, men who, when you say emotional, well, especially from where we come from, maybe from our own side of the cultural background, emotional, what does that mean? Get on with it, and there are people even in the science world, the doctor world, who will see women, they're men, they'll see women and they say, well, my mother went through it, get on with it. You don't sit there and say you have all this, but things have moved on, things have changed. We know that is a main issue. We can't just sweep it on the carpet for those who are suffering. Not everybody is going to suffer this. A quarter of women might have zilch, nada symptoms, and they will be fine. But for the other people who have very severe symptoms, like another 25% will have very severe symptoms, even they can be suicidal. And those who are somewhere in between, who is just mainly, I can't perform, and it's affecting their mood and physically, then there ought to be something to manage that and for them to be acknowledged that that's happening and the reasons why, and validated and supported. So it can cause a communication breakdown. All the things I've said. You've woken up that morning, you're tired, don't want to talk to anybody. Husband says something, you're enraged, you just fly off the handle. The man doesn't understand. What's wrong with this woman? I've lost the woman I married. What is going on? It begins to break down. From there, there's distancing. There's distancing because, the woman feels the man doesn't understand what I'm going through. He doesn't want to listen. I'm not even going to talk about it. He's not supporting me. Sometimes the woman might just want, somebody just to understand, just to, it might just be a cuddle. They don't want it physically intimacy, but a cuddle will help them. It will help them settle down. And it's this sort of simple things. But maybe the man doesn't understand, or the woman doesn't even know how to talk to the man about it. And because of all of that, there's a lot of all these mood problems. The man doesn't understand, the woman doesn't understand. There's argument. So the woman is already angry anyway. She's already on a short fuse. And then the man says something and then she just goes. There's a fight. There's conflict, distancing, everybody, she's irritable. And you can imagine the man thinking, well, she has now become, something else. I've had women say, the husband said to them, go and sort this out. I don't think this is having an impact on us. And imagine it's hormonal. The woman doesn't have control, so it's quite tricky. And then in certain areas, obviously, where people hold the sanctity of marriage, they just feel like this woman, maybe physically she's not as she was, mood-wise, I can't even mood near her, she has become something else. I'll go and find some comfort outside. That's another thing. Not it should not happen, but these things do happen. This can then lead to obviously breakdown, divorce. There's a movement now. There's this woman, she's a specialist in menopause, who is working with some lawyers because they are seeing that a lot of breakdowns or divorce that's happening is around menopause, perimenopausal age. The woman is instigating it and is getting to the courts, and the decisions that are made may not favor the woman in terms of splitting of financial assets and things like that. So there's research going on into it as to, okay, how can we begin to educate lawyers? How can they begin to factor this in this sort of if unfortunately it has reached that stage where the woman feels they are going for a divorce, but divorce is not always the answer, and some people regret that they went through that. But again, their mind, they were not really in their right state of mind at that time. So these are things that are that are real things that can happen. And obviously the loss of physical intimacy doesn't really help. The woman's drive is 0-0, they're down there. The man's drive is quite high, and there's a mismatch. And obviously all of that can contribute to problems. And obviously children, they don't understand. And I've seen women again who say, they just find that they are snapping, and they will say things they, ordinarily, you'll say, this is, it's not me, it's not me. And I can empathize and understand with that, yeah, it's true that it's not them. And then the children will sort of, okay, I don't know what's wrong with mommy, but they don't understand. But if they're old enough, maybe in their teenage years or older, communication will normally help. So, so this leads to, so what are the practical issues? There's just one more slide, guess. What are these practical issues? So the issues that are on ground now is that maybe, you've got somebody, and this might not be for any one of us here, it might be for our loved one, maybe a sister or a friend or somebody we know at work that is going through this, and how do I explain to my partner how I'm feeling and why it is happening without arguing? This is a practical thing. Okay, how do you sit your husband down? There are women whose husbands will be happy, they will understand. But what of those who maybe they're not even on ground all the time, and they're just the ones that, the emotional a phrase doesn't necessarily float their boat, and they're like, if come again, woman, you're from my culture, we say woman palaver, and they just don't get it. And it's an issue for the woman because she's truly suffering. So how do so it's with tact, it's with a lot of things. You might want to just change the way you do things, change it up a bit. It might be that you want to go out and talk about it. Obviously in the Western world, that's always something you can do. It's not that you can't do it in other places. You can sort of just change the environment, have tactfully approach the issue. Is emotional. It's a roller coaster. The hormones are changing. It affects the brain. It affects the physical body. It affects the organs. Sometimes I might not even understand how I'm feeling. Please bear with me. And it's the way you put it forward. And if you have somebody who understands, obviously, you can then move forward. Remember, it's a phase. It's going to pass, but it's what you do while it is happening. The woman can start feeling that, this man does no longer, floats my boats. I mean, just the way they're feeling, they feel that physically they're just not like they were before. They were not, and that can cause an issue. I've talked about how we are seeing it, that, research is even showing that, yes, it is a big thing in terms of the women initiating a divorce, or even the man. The man too can initiate a divorce because he's just no longer interested. And he doesn't really need to get to that. Don't make a rash decision. Stop and think about it. Practical issue 3, loss of libido. Big thing. Big thing, because that is like a glue that keeps marriage together, and hormonally this is sort of now affected. What do you do about it? It can be so bad that women can feel, I don't want anybody to come near me. I don't want clothes to even touch my skin. It's hormonal. It's not the woman. It's just that hormone is what is driving that. The nerve endings are responding to that reduction in hormone in a different way. So if you touch the feelings that she will get from touch previously is not what she's getting now. She doesn't want it, but she might just want a little, talk, and she'll be fine. So it's understanding all these sort of things. And then some people, maybe it's not that bad for them, but because their libido is zero, the man's libido is high. Okay, I'm not happy, and they're fighting, and he's threatening to leave. How does she then cope with it? You might want to begin to think, okay, what are there things that can be done? Like I said, we've talked about communication. We've talked about changing things up, changing the whole scenario. You can start courting again, begin to woo each other once again, begin to do things, just simple things that can sort of change things around and help facilitate your understanding and communication. Obviously, again, see your doctor. There's treatment, there's HRT. Try that. If you don't want to go down hormones, there's exercise, there's eating a healthy diet, there's losing weight, there's staying active, there's trying to just think about, okay, do I need some space? Do I need a break? Do I need to go on holiday? Do I just need to breathe? Talk to your partner about it. Get something to engage your head. Things that you've always wanted to do, you've never been able to do. Maybe that's the time to just sit and channel your energy into that. Try not to isolate yourself. Talk to family, talk to friends, join a community, speak to somebody that you can trust in church. If you're a Christian, we're believers here, pray, talk to God about it. He has said that even during, till your gray years, till your old age, gray hairs, I am he who sustains you. He can pull you through it, no problem. And just always remember that it's a phase, it will pass. These issues are very real. And it's how we navigate it so that our relationships remain are able to weather the storms of this particular wind in life. I hope that's we should sort of stop too. Yeah, thank you.
Thank you so much for that, Dr. Yemisi. Really appreciate that. Just to reiterate that those that have just joined, if you have any questions, feel free to use the chat, use the Slido hashtag Mr. and Mrs. or use the raise the hand button. Olu, is there anything else you want to add before we move to the next speaker?
No, I think we can carry on. Yeah, we're good.
Okay. So just because we've got a couple of questions on Slido that we want to go through today, we're going to move to the next speaker that will take us on the andropause, so the male leg of menopause. So I'll let him do the introductions. Dr. Abel.
All right. Good morning, everyone.
Good morning.
It's good to be here today. I'm actually grateful to God that I can make it. I took ill yesterday night, but thank God I'm able to come this morning. Yeah, my name is Abel Adegoke. I've been a GP in the Northwest on the Wirral, coming to about 30 years now. The other thing I do is a primary care cardiovascular physician. So last time we talked about andropause generally, and so I will share my slide now. If there's any problem, please rescue me. I've sent it. But can we see my slides?
Yes, they're well projected. So
All right. Okay. Thank you. So that's who I am. I want to start with some of these quotes that I have here. It's my first one is from book of Proverbs, chapter 20, verse 28, which is talking about the place of unfailing love and faithfulness. And I will expatiate a little bit more on it when I get to what I'm talking about. I'm talking about the effect of andropause on marriage. Every marriage has to be built on unfailing love and faithfulness. So we will see the effect of that as I go forward. Rick Warren, an American preacher, said a great marriage is simply the union of two great forgivers. Again, you're going to see the reason why this is important as we go ahead with the presentation this morning. And I tried to find the author of this statement who says a perfect relationship isn't ever actually perfect. It's the one where both people never give up. So three strand I want you to lock in your mind on this talk as I go forward is: one, faithfulness and love, unfailing love; two, forgiveness; and three, never give up. That's what can help us to navigate what I'm going to be talking about this morning. Previously, I defined what andropause was. I mentioned that andropause was syndrome, and I said syndromes are aggregation of different symptoms, with which associated with decreased sexual function or decline in general well-being when the level of male testosterone goes down. Testosterone is an hormone that the body makes, and is the main male hormone, whereas estrogen is the main female hormone. Okay, so some of the symptoms of andropause, which we mentioned last time, include sexual dysfunction. So, and when we talk about sexual dysfunction, it's mainly about reduced libido, like my sister mentioned, when it comes to menopause. In men too, when you have andropause, there's reduced libido, or sometimes associated with erectile dysfunction. The simple reason why this happens is that testosterone is what drives libido. And when you lack it, then you have reduced libido. It's like not having appetite to eat. And if you don't have appetite for food, people begin to speculate. Have you eaten? You came home and you say, well, I don't want to eat. So are you unwell? No, you are not unwell. Why are you not eating? Have you eaten somewhere? Those are the kind of issues that tend to happen when you have reduced libido. There's associated problem with mental well-being. So, which is just like the female one that we've listened to. Mood swings, again, feeling suddenly sad, unhappy, and you can't put your finger on what is responsible for that. Feeling depressed, very, very low in your mood. Poor concentration, very irritable. We heard about brain fog. when you just suddenly discover that I lost what I was going to say. I suddenly couldn't remember what I wanted to say, or everything just looked blank all of a sudden. Then physically, the effect of andropause is you become very tired and weak, because you need one of the effect of testosterone is to give you energy and strength. Helps in building your muscle, help in building your bones. And when you don't have it, you become suddenly very weak, tired, fatigued. Simple thing, you're tired, you're unwell. Muscle begin to become more and more flabby, because you're losing the quality and the mass of your muscle. In some men, then there will be some breast enlargement, because now you have disproportionate level of estrogen, because every man, every woman, we have both hormones. It's just in the proportion we have it. So a man has estrogen as well as testosterone, but testosterone is the main one. So if you have a reduction in the level of your testosterone, then your estrogen level becomes slightly, in terms of comparison, slightly higher, until you begin to develop women characteristics. Okay. So the effect of andropause, which I've mentioned last time, is it brings stress into life generally, unfortunately, because these are hormones that we need to function. And if they've gone suddenly, then it brings stress into people's life generally. It brings strain on relationship. It leads to loss of bone density, which makes your bone to become easily, become very fragile and breaks easily. So these are the areas I want to concentrate on within the time I have. Sexual dysfunction, I've mentioned it earlier. I want to expatiate a little bit more on that. If you listen to our sister who just finished speaking, she was talking about men having a high sexual drive. One of the instincts of human being, basic instincts of human being, is sexual function. It's like feeling thirsty. It's like wanting to eat. It's like wanting to survive. Those are instincts of human being, and sexual function is one of them, especially more developed in men. Men actually have a lot of libido, a very high libido. So if all of a sudden they begin to have no or low libido, that's going to affect relationship. And the problem comes when your spouse does not understand. This is somebody who we have sex almost every night or every day, and then all of a sudden they're not even thinking about it. They're not even trying it. And I can tell you, for a man, that's going to be very, very, very distressing for them. Initially, they don't know what's happening, and that's why education is extremely important. They don't know what's happening. They don't know why this is happening. Coupled with the fact that there's something called irritable male syndrome, when they just snap like that. They just snap, they shout, they yell, and especially those of people from Africa, who don't have some not everybody, but some people don't know how to gently, nicely deal with their wife. Then they shout, they yell, and they transfer their frustration onto their wife. There's loss of intimacy, and because there is loss of intimacy, that will lead to major problem in the relationship. Relationship breakdown happens quite easily as a result of this. And we've seen people who have gone out thinking that their problem is from their wife, And so they went out and get another woman. But that problem is never going to be solved because the problem is with them. It's just like some men who are unable to, if there's a problem of fertility and they are the cause, but they didn't know they are the cause, so they go out and find another woman, whereas they are the cause of the problem. The same thing is happening here. Andropause is the reason why you don't have sexual drive, you are irritable, there's no intimacy, and going out to look for somebody else is not going to solve the problem. It's actually going to multiply the problem for you. Unfortunately, like our first speaker said, we have seen few people who ended up divorcing their wife because of what has been going on, because of lack of understanding. And it will definitely impact on the children. So what do we need to do to resolve this? I think what you are doing is extremely important. Education. What my sister said about menopause, what I'm saying, that's the only way people will know that there is something that is causing this problem. It's not somebody from Nigeria who wants to destroy your marriage. It's not even the devil. It is natural thing that is happening that you need to have an understanding about. Education. And so I know you're doing this for women. I don't know how you're going to get their husbands to be involved in this. Sister Tolu, I'm
No,
looking.
we have men. This session is for both male and female, sir.
Good. That's very, very, very good.
So
Because
we have men.
It's very, very important for men to have that understanding that what we call menopause in women, we have something not exactly the same, as I mentioned in my previous talk, but very similar going on with men. And we need to know it. We need to understand it. We need to appreciate that it's real. And we can't even say I reject it in Jesus' name, because it's something that will happen to us naturally. How to deal with it is very important. And one of the ways to deal with it is communication. We just need to talk about it. I know often from my experience as a doctor, men generally in their macho type of attitude don't want to talk about things. But my brothers who are on this call, please talk about it. If you notice things going on with you, you notice that you come home, you are unduly tired, you don't have interest. Before you begin to think it's your wife that is no longer looking beautiful, think about, am I getting to this problem? Is this happening to me? And communicate. Talk about how you feel. I think if we can communicate amongst ourselves as husband and wife, a lot of problem will be solved. The problem is we don't communicate. We just bottle things in. Now, remember, irritability, because you've been bottling a lot of things, you just bust up like that. And it will be like, whoa, what's happening? What have I said? What happened? Is because of the way you have been feeling, but communicate it so that your wife will understand. Seek counseling. Talk to somebody who can help you to say, this is the way I'm feeling. Please, how can I receive help? And I put consultation there. Basically, go and see a doctor and say, look, this is the way I'm feeling. Because like I mentioned in my previous talk, some of these symptoms are not only from andropause. You could have it as a result of another major sinister underlying problem. So that's why you should consult your doctor so that they can look into it. And if it's andropause, they can help you in caring or in managing it. Now I put caring there. Caring, this is for your wife. Actually for both of you. You have to care for each other. You have to be respectful of each other. You have to be very kind to each other. You have to, especially when you are getting to certain age. Now they're bringing up something called couple pause, where the husband is going through andropause, the wife is going through menopause, and you can imagine what a bad combination that is going to be if you don't understand. And you just care for each other. You look after each other. I do a lot of counseling for married people, especially young people. And I tell them, especially if you have just come to the UK, that, well, you are far away from home. This is the person, your husband is the only person you have here. Your wife is the only person you have here. You have to look after each other. You have to care for each other. And there are medications that are available, which we can prescribe for people, which have been found to be useful for, for men to improve their sex drive, to improve their erectile function. There are medications that will improve some of these mental dysfunction that I've mentioned, and just make you like a woman who is starting on HRT will say, I'm like a new woman. It can make you a new man, really, if that is needed and you get the appropriate help. Now, I want to finish by linking my initial opening statement with how I'm going to finish. You will see that at the beginning, I put unfailing love and faithfulness. I put that you have to learn to forgive. And I put that you have to know that no perfect marriage is just because your marriage appear perfect because you are not giving up. Love and faithfulness will help you when your husband or your wife becomes very, very snappy, very uninterested in you. Your love for him, your love for her will enable you to carry on going. You remember how you started, you remember what brought you together, and you nurture that. Your wife can snap at you or your husband snap at you. The only way you can go ahead is just to learn to forgive each other. And of course, don't give up on each other, because if you do, that will be the end of marriage. So to finish, there's this guy called John Wagner. He is a comic writer. He says, don't let aging get you down. It's too hard to get up, to get back up. So basically, we're going to age, we're going to, as long as we're living, we're getting older and things are going to be changing. Is the truth of the natural world or the fallen world we belong to. But don't let that get you down. Don't let that come in between you and your marriage, in between you and your relationship. You've got, as a child of God, and I'm saying this to us because I'm believing and assuming that we are all children of God. As a child of God, we have responsibility before God, first and foremost, to look after each other in our marriage. And whatever we can do, we shouldn't allow the fact that we're changing, our age is changing, things, our physiology is changing. We shouldn't allow that to affect that relationship. Finally, if you read Ecclesiastes chapter 11, verse 9 to 11, say, young people, it's wonderful to be young. Enjoy every minute of it. So if you haven't started experiencing andropause and menopause, please enjoy the wife of your youth as a man. And that will be something you can keep going back to. I like the way the NLT says, do everything you want to do, take it all in, enjoy yourself. But remember that you will have to give account to God in the way you deal with each other. So I pray that God in His mercy, will help us to have the right understanding and to do what is right for one another. Thank you very much.
Thank you very much, sir. That was a fantastic piece. Thanks once again. Okay, we good to start taking questions now. Okay, good. So just to those that are just joining, please, you can put in your anonymous questions through Slido. The hashtag is Mr. and Mrs. all joined together. There are some text in the chat room on how to get access to Slido and ask the questions. Okay, so we've got a couple here. And I think I probably would push this to Dr. Yemisi. It's like, is it normal for menopause to start at 35 plus years? And there's a second leg to that question, that is it possible for menopause to run in families? So probably is there a genetical linkage to early menopause? Yeah.
Thank you for that. Yes, so is it, thank you for that question. Is it normal, is the question, for menopause to start at 35 years? No, but it happens. There's a medical condition we call premature ovarian insufficiency. So what that means is that the ovaries stop working way before they should have stopped working. Yeah. And so are there genetic, so it's not very common. It's about 1% of women of women who are menopausal. Yeah, just it's very a small proportion. Now it's a variety of reasons why it happens. Now there is a genetic preposition to it, so problems with so there's something we call Turner syndrome, for example, which just means that your X and Y chromosome, I don't want to spend too much time, your X and Y chromosome is just not what is meant to be. Okay, so what that means is that then that woman might not have, her ovaries might just be infantile, so they don't develop. And if they don't develop, as we all, like I said from my last talk, why do we have menopause? You have ovaries. You have a functional ovaries has functional eggs. You have about 2 million of them when you are conceived. They begin to whittle down over time till when you get to the menopause, when they finish from the ovary. So in some women, when that it would finish early or they don't even have enough from the start because of genetic problems. And so if they don't have enough, or the other thing that can be common, I can see maybe in places where there's a preponderance of infection, apart from genetics, if there's an infection that affected the ovary at an early stage in life. So there's just like moms can affect the testis in men. You know, there have been documentations about malaria, tuberculosis, just infections basically that can affect the functionality of the ovary. So it just affects the way it's working, and then you don't have enough eggs, and then you don't have enough eggs, you don't have estrogen, it stops. So yes, it can happen, and it can be genetic, but not necessarily. So it depends on what. So it will not necessarily. Well, I've seen patients who come and say, "Well, my mom had it, my sister had it." Yeah, and so things like so you can't find people whose ovaries will stop working early in life or earlier than other women. And there are other things that can contribute to that. So things like smoking, for example, there's evidence to suggest that people who smoke and it can make their ovaries stop earlier than others. Yeah. I hope that answers the question.
Yeah, and it does. There's a comment online. I think it's Teresa Ekong, and I've been trying to chat them up again. It says, I have a record of someone who started at 5 years old. I'm just curious to understand if that's 5 or 50 they were trying to say.
No, it was 5 years old. This
Okay,
is 5 years old. Obviously, very, very rare. But I was just wanting to point out that there could be aberrations, where people are completely odd. Thank you.
yeah, thank you. That's true. Okay, good. A couple more that I'm seeing here. I think this, I'd let you both decide who wants to take this. Says, my husband is just 40 and he has been very irritable and it has led to separation. How do I deal with this? That question doesn't have all the parts, so you probably wouldn't get everything. But if you can follow on with a bit more context as they start to answer this, I guess you probably would get what you want. But if you guys want to take any start, any of
Yeah.
you can give us.
No, I'm happy to take it. Actually, there's another question about two before that talk about, the speaker just mentioned symptoms of andropause, and I can recognize a lot of these in my husband, but now we're divorced. Again, menopause is very easy to recognize, relatively, I mean, because there's been a lot of work done on menopause. Plus, also the way menopause happen is that it's like you have a clear-cut time when these changes come in a woman. And like the speaker, my other speaker I've just mentioned, is because you lack you've used basically used up all your eggs. Andropause is a problem, it's a slightly different problem in the sense that there isn't even any specific age or time when your testosterone goes down, because right from once you reach the age of 30, you begin to have drop in the level of your testosterone. And a lot of people with that drop have no symptoms or any effect on them at all. So, however, generally speaking, we're looking at from about the age of 40. In a study done in Canada took age of 40, a study done here took the age of 50. From then, you begin to see that the level of the rate at which people are losing their testosterone is so great that it begins to have some of those effects that we mentioned. And unfortunately, if you don't recognize them, there are a lot of divorce that have taken place that when you then discover how it happened, what led to it, you can see that there are other issues, much more than that is, oh, some people will say it's become unreasonable. I can't live with him anymore. It's become totally different. I know a man who was telling me that God gave me my wife, but the devil has taken her over and stuff like that. And the problem is either the person is going through this menopausal or andropausal problem that we're talking, or there are a lot of psychological issues that can affect relationship. And that's why it's important for us to remember how we start. Because if we don't, when you begin to see changes in your spouse and you don't understand, then you can overreact. So it's a shame and it's unfortunate that that marriage has divorced now, and there has been divorce in that marriage or led to separation, because there's issues that could have been dealt with if we had known. So it could happen at age of 40, it could happen at age of 50. There's no specific age. But like I also said, it's not only andropause that can give you those symptoms. There are other, at least for men, there are other issues that could be responsible for the way you're looking, that the man is behaving or what's going on in the man's life. Generally, they call it midlife crisis. It could be andropause. It could be other issues. But I think the bottom line, before we rush to divorce, before we rush to separation, is to educate ourselves, communicate with one another, be very compassionate with one another, seek guidance, seek counseling, seek help. Thank you.
Oh, thank you, sir. Buki, do you have any questions to pick through?
You can go ahead, Olu.
Okay, no worries. I'll go ahead with this one. Okay. So the next one is it usual for periods to have periods every 3 weeks, as this has started to happen to this has started to happen? The person's 49. Does this mean menopause has started? Other women in family, let's say. So I think they're saying just because this person's probably compared as a symptom to some other members of the family at the same age. They don't seem to have the same symptoms. But yeah, that's the flavor of the question. Period every 3 weeks, 49 years old, is menopause, are they on the onset of menopause?
Thank you. Thank you for that question. So the cycle length of a woman varies, as a normal cycle length can vary actually from between 21 days to about 35 days. Normally, some people can have it up to 42 days. So what that just means is that if you have your period today, the first day of the full flow is day 1. By the time you get to 21, if you count 1, 2, 3, 4, 5, you stop bleeding maybe around day 5 or 7. By the time you count to fast forward to 21, you start another bleed. That's a 21-day cycle. And some people, that's normal for them. Most people is about 28, so every 28 days, some people 35. And sometimes you can give 2 days earlier, 2 days later, a week earlier, depending, that can vary again as a normal thing. Now, when women begin to approach the menopause, so I said earlier that one of the definitions, we define the perimenopause. So the perimenopause is the period, the number of years around the menopause, and it can be anything between 2 to 6 years. So the eggs are diminishing, so the hormone is falling, and it can be very gradual, but because that hormonal change is gradual, and it's gradual, and sometimes it can also fluctuate and can be high today, low tomorrow. That affects what happens at the level of the womb, where the lining and how the woman will shed, have a period, basically. So yes, when the hormones are changing, some women begin to have flow problems. Also, the periods can be longer, they can be shorter, the cycles can be closer together, they can be farther apart together. What tends to happen in most women is they might become closer and closer together, and then they start to become further and further until they stop. And then once you have 12 months, no bleed, that's menopause. So has she reached the menopause? No. She's probably perimenopausal. She's having flow problems or cycle length problems, probably because the hormones are changing, basically. So if she used to have 4 weeks before and it's now 3 weeks, yeah, she's probably the hormones are just not, she might not be ovulating. And the other hormones, because when you ovulate, you have apart from estrogen, you have the progesterone. It's the progesterone that holds the lining of the womb. And when it begins to fall, when there isn't fertilization, you have a shed, or a bleed. So if you don't ovulate, you don't have progesterone, so you might not then hold your lining long enough, so the periods are shorter. So she's perimenopause, not menopause yet.
All right, thank you, sir. Thank you both. There's an interesting question here, and it says, are there proven researches, and this is, I'm thinking maybe research, experimentation, that has linked the lifestyle pattern to the early onset of either menopause or andropause? Yeah, that's the nature of the question. So literally, the way I understand the question is, are there things that you did when you're much younger, that could help you preserve when this inevitability would happen? Yeah.
I will come from cardiovascular angle. I think lifestyle is key today. The way you use yourself as a young person is going to tell how you will be in your old age. If you don't look after yourself, if you drink, if you smoke, those are bad or unhealthy lifestyle choices that some people may make. It's going to have effect on every aspect of you, including your hormones. So will he necessarily make you have early menopause or early andropause? I don't think so. I've not read any specific report. However, it will have other effects that can exacerbate whatever your andropausal or menopausal symptoms are like. Take, for example, osteoporosis is common to both menopausal and andropausal people. But if you are chronic alcoholic, you're going to have osteoporosis, which is brittle bone disease. You're going to have that even before you get to menopause. And once you get to menopause, it's even going to make it worse. So there is nothing better than having good, healthy lifestyle as a young person, because then you grow up and become and carry on even with that kind of lifestyle. That would be my answer on that.
Oh, thank you very much. I was just going to flip back to the audience. Does anyone have questions that they would like to ask not using the Slido or any contributions. If you do, please use the hand raising option and we'll unmute you to ask your questions. Okay, let's move on to another question that I've got here. So this is flipping between like relationship communication type style. Is it okay to ask an older friend about her menopausal symptoms? And I think it's affecting our relationship. So the way I look at it is someone has been listening to you both. They've actually, or they've been listening to you both, or been Googling. Now they've understood what a menopausal symptom looks like. Then they're now diagnosing their friends. And they're trying to, they're diagnosing their friends and they're trying to then talk to them about that. Okay, is that intrusive? Is that too much? Is it okay? I'll throw it open. Yeah.
Okay, so can you speak to somebody based on we thank God for the knowledge has greatly increased, isn't it? There are TikTok videos, there are all sorts of YouTube videos. People are self-acclaimed specialists in their own right, and they see things and they just make a judgment call. Now, obviously, can you talk to somebody about somebody senior to you about it? Well, I suppose it depends on the kind of relationship you have with the person. These are symptoms that are well known, published. We know that they happen. So I think if somebody sees or observes that this might be what this person is going through, I don't see any reason why they can't go and, if they feel they have that rapport with that person, they can go and talk to them about it. But if you're not sort of like a trained person who makes that diagnosis, then maybe don't go and tell them that this is exactly what they've got. But you can obviously share your thoughts. Of course, by all means, share your thoughts and see what the person says. If it's something that is affecting their life significantly in terms of and having an impact on their relationship and is affecting them, you can suggest to them to go and see somebody, somebody, their GP or somebody who is trained in that sort of area, and that person can doctor was saying earlier on, a doctor can then explore and look in depth, because to be honest, it's not every symptom that looks like menopause that is menopause. There are other physical conditions that can make people flush and have night sweats and cysts cause things like cancer. Basically, they're not common. Menopause is far, far, far way more common. So if a woman is in that age and she's most likely menopausal rather than having cancer. But there's always that we need to always think about that. Yeah. So I don't feel there's any reason why people cannot suggest or make their ideas known just to facilitate or help people to get help for themselves. Does that answer the question?
Yeah, thanks. Actually, I got a friend of mine pinging me, and I'll have to ask this question. So it's saying, does vasectomy contribute to andropause?
Vasectomy?
Yeah.
No. A
Okay.
completely different thing. So it doesn't affect it at all. I think that's the simple answer. If we want to go into the physiology, we probably will be talking too much. But I think it's no.
All right. Thank you. So we've got a hand up. Sister Teresa Ekong, let me unmute you and you can ask unmute. I think you can unmute yourself and ask a question. So
Okay, thank you so very much. I want to start by saying thank you to the two people. I had the privilege of listening the last time, and I did say to Tolu that I found it really fascinating. That was my first time of hearing the term andropause, and I immediately went and looked it up, and I've since been looking into it more. In my workplace, I lead on EDI, equality, diversity, and inclusion. And actually, during this week, I hosted a session where we looked at menopause and andropause. That's just to show you, okay? And in that meeting, most people hadn't heard of andropause, okay? And in that meeting, a lot of people had not heard of quite a few of the symptoms. They were not aware of it. And I'm talking about modern day people, not old fogies like ourselves. So first thing I want to say is I do completely agree. This is such an important area. Please don't take it for granted that people know everything. Very few people do. even if what you said about forgetfulness, forgetting, being in the middle of something, a big meeting, and you're in the middle of a sentence and you can't remember what you want to say. Exactly, somebody said the same thing happened to them. So I just want to say this is so important, and I'm excited that it's happening. We need to have more of it. Education, awareness raising, information. That is what we need. Thank you.
Thank you.
All right. Thank you. The reason of the question, so there's a question around, I think you guys might be able to help navigate around this. So this question is around, I'm experiencing, so this person is experiencing some of the symptoms which we've discussed in here. They are planning to have a conversation with their GP, but we all know at times that GP can be initially very dismissive, and they're trying to ask for the techniques on how they can press and make sure that they get what they want. You get. So I'll read the verbatim. It says, if I go to my GP to explain all my symptoms, which I think might be menopausal feeling, but what if I'm dismissed and the issue is still going on? How do you press? So I guess this is more of a process type thing. Any tips you guys might have on?
Yeah, generally speaking, I don't think the statement that GP are dismissive is exactly true. However, I appreciate where they're coming from. What I tell people if they say I've been to my GP and he says, "Don't worry," is to say to the GP, but I am worried. And if a patient tells me that, but I am worried, he makes me to think about what else can I do for them. It makes me to think about, well, if I've explained things to you and you say to me that I'm still worried about it, then I want to think, I don't want to miss something important. So I'm going to then initiate a process. I think it's insistence without being rude, without creating scene. Just say, well, I'm really worried. Can you do X, Y, Z? Or somebody has told me that this could be menopause. How will I know it's not menopause? So those are the kind of way to go about it.
Any other Sister MC, any you can add anything?
Yeah, I think that's right. I mean, I do agree. I know that, unfortunately GPs have a lot of bad press and bad sort of, yeah, they don't want to listen, they could get fobbed off and things. But we all know that it's a bit difficult in the NHS at the moment in terms of demand and supply, but I don't want to go into that. But I don't think there's any at the current level now where with the publicity and even the government's women's health strategy and the things that are out there, I don't think there's any GP that patients will go and talk to. So a woman in that perimenopausal, menopausal age will go and speak to her GP and say, look, this is what I'm feeling. And I think I might going through the menopause. Can you help me? I don't think there's any GP that would dismiss that, because there's just too much information out there. Even the government has taken it as priority. People, and I know that obviously some years before, maybe there was not much enough information, but there's training now, there's research. Even if you're in the menopause world, you might have heard of somebody called Newson. She's called Newson. She's a specialist in menopause, and she does that. There's also some research work that she's doing. And I was quoting one of the studies that they were doing, looking into divorce rates and lawyers, and there's a lawyer actually at the back of that, their menopause divorce project. So it's a big thing. So I don't think your GP will dismiss you. Just if they're under pressure and there's no time for that conversation, when you book your appointment, you can ask if it's something your GP offers, ask for a double appointment. Tell them that it's something you really want to discuss because it's having a huge impact on your quality of life. I don't think anybody will dismiss that.
All right, thank you.
Yeah.
Oh, sorry, you're gonna say something.
Yes, I was just going to mention, I saw some comments flying through, coming through about, somebody mentioned something about testosterone being normal, aging, declining with age. I acknowledge what that person is saying. Now, it's a bit like the menopause. We know that the estrogen and progesterone will decline with age. Some people will not have much symptoms. Some will have severe symptoms. So people can be anywhere on that spectrum. So the fact that your decline of testosterone is not affecting you doesn't mean that it's not affecting another person. So we need to be sort of weigh these things up, because we are all very, very individual. Our cells are very different. Our body reacts very differently to changes. And if you are suffering from symptoms, please go and see your doctor. I know men who had symptoms that doctor was talking about. Testosterone was low. They're on injections. Their life changed. Testosterone injections. Their life changed. So please, it's worth knowing that everybody's different. Some people may not have symptoms, but some people do suffer and will need treatment.
Oh, I actually saw the same comment, and I was just going to mention that if you were at the last meeting, and even today, I've mentioned that all those symptoms are not necessarily andropausal problem. They are a reflection of other problem. But once you exclude those other reasons, I mean, for example, stress is normal if one overwork, but not everybody feel as stressful as to become very snappy, as to become very weepy, as to become very disengaging because they're stressed. So because they are worked hard. So there might be underlying problem. All we're saying is, unfortunately, like I said, there's no laboratory diagnosis for either menopause or andropause. You don't go to the lab and do some test. For menopause, we know that the level of some of your hormones will be unduly high to suggest that you are menopausal. However, your testosterone level may still be normal or low, and you don't have any symptom, but it might be the reason why you're like that. So I wouldn't dismiss it that testosterone level decline is normal with aging, and yeah, it is, as I mentioned that, but some people it affects them terribly more, and that's all they need to replace. They just do testosterone replacement therapy for them, and their life change completely. Yes, I admit that other reasons can give you those symptoms, and that's why you don't just assume it is.
Thank you both. There's one question that I'm seeing online. I think you guys have touched on it, but I was gonna put a flip around it. So I think, should there be so do people get actually? I'm guessing, do people get diagnosed as being andropausal? So you've looked at all the symptoms and you've concluded that this person needs to be diagnosed. Then I'm then thinking, can these people take this diagnosis to their workplace and then be able to get support from there? Because I'm guessing you're a line manager, somebody's acting erratic. You don't know if that's because it's under proposal or something. You're just hitting back and they hit it back at them, and at the end of the day, they either resign, or you further ruin them. So I'm trying to see from your experience, are you guys seeing anything where people are getting this diagnosis and they're using them to get support externally?
I mean, for women, it is the end thing now. There's even a department in Department of Health that is championing menopause at work, because it's a great problem. It's been recognized over many years that it impacts negatively on women and their ability. And like our sister said, usually at the level where you are in a high level position, very high level job. And at that point, because of that, and because there's been a champion about menopause for women, it becomes something that workplace, even NHS, are now being mandated to look out and support women. That kind of support is yet to be available in the UK, but it's a matter of time.
Yeah.
Because it's a real issue, is a reality that we're seeing. Partly, it's not as commonly seen because men tend to, like we have seen, men tend to just get on with it and keep quiet over it and keep suffering in silence. But in places like America, in Canada, it's a big thing that and I think it's just a matter of time before it becomes an issue here in the UK. And when it gets to that level, the same thing that is happening with menopausal problem will begin to happen to it. I mean, remember that there was maternity leave for several years before they now started thinking about paternity leave. So it's just a matter of time. We will begin to have people getting diagnosis of andropause and getting the right support. Currently, I don't think that is available widely. But if you go back to your workplace with explanation from your doctor that says, look, this is what we think is happening to you, then you should receive help, irrespective of your diagnosis.
Okay, thank you, sir. Dr. MC, any addition?
No, I think that's absolutely spot on. It's a matter of time.
I've got a hand in line, but I'm just thinking, and this is just me just playing devil advocate there. So it'd be good to know if this is leading to ageism and higher bias. So this is you now, a hiring manager. You have someone of 45, 50. You're thinking, oh God, I've listened to this topic. This person will become relatable in 2 years. Then you've got, sorry, I'm just trying to liven this up. Then you've got a 35-year-old person. Obviously, the 50-year-old person, 52-year-old person probably has all the skills to do the job. I think, I'm not ready to deal with this. And I'm sure it's happening somehow. It could be silent, but I'm sure it's probably happening. We've got Teresa, Sister Teresa. I think you have something to share.
Yeah, I'm going to address both topics, including your devil's advocate one. So the first thing I want to say, actually, although menopause is more common, I don't think it's necessarily as widely publicly acknowledged. For example, I'm in the civil service, and the reason I'm saying this is that everybody knows about it, but it's not like disability, for example. It's not like, I can't say racism. So what I'm trying to say is we're still to get there, but there is a lot of acknowledgement in the workplace that it's a very, very major drain on workforce. Our workplace is 59% women. Okay, that means at some point, all those people are going to be somehow affected. Now, when you add the men with the andropause aspect, you're looking at a major part of the workforce. So I think it behoves workplaces to actually look into this. And my prediction, if I were a prophet, I would say in the next few years, you will see menopause added to the list of protected characteristics that you cannot discriminate against. Okay, a couple of MPs tried it last year. They just failed to achieve the number of votes needed to pass it. So as you said, Dr. Adegoke, I think these things are in the pipeline. That's the first part I wanted to share. Second part, based on your devil's advocate, actually, it's illegal to discriminate on the basis of age. Okay. I don't know if you're aware, the upper age limit for work has been removed. Okay, previously you were forced to retire, I think sometime many years ago, as early as in the 50s, and then it was increased to the 60s. Now the upper limit has been removed completely. What this means is that if there is evidence that you discriminated against somebody, you are liable to be prosecuted. And I think that is good, not just because I'm old myself. I'm an old fogey, you can tell from what I'm saying, but actually because that provides a balance. Yeah, the youth will bring their own, the middle people will bring their own, the older people will bring their own, and together you give a whole composite picture of expertise and innovation. Thank you very much. Mm-hmm.
Thank you. Let me check on my co-host, Buki. Any additions, subtractions
So I
before
was
we?
gonna say that was a good point, Olu, right? But what if we don't say that the reason why I'm not taking this person is
Buki,
due to age?
I
Can
know
you
where-
hear me?
yeah, I know where you're going. I
What
know.
if you don't say that's the reason, but
Yeah,
just to protect yourself?
yeah,
But
because
again, to Dr. Ekong's to what she said, right? it's just like a pregnant woman. If you go for an interview, they would favor you. You would be considered highly if you're quite good compared to every other person. So
Yeah, I think what I would love to see as a legislation is something that it's hard for you to regulate like HR and organizations in that space, but because as a hiring manager at times you can do an interview and who cares? You write whatever you like in the feedback form and send it back, and you can just say no. So you could be very vindictive in your choices, but I'm guessing organizations probably have a lot to do, and I think I picked on what Sister Teresa Icon said. Diversity creates that mutuality of value. You must have varied kind of people in your team to be able to get the right value. So that could be another topic in its own right. So there's a question here, and I'm not probably it's like a three-in-one question. So, but I think I'm linking it together. So it's saying, I'm guessing this person has been taking contraceptive for a while. I'm guessing the contraceptive is now leading to the thinning wall of the uterus, from what they're saying. And there is a potentially symptoms of menopause. So there's a menopausal symptoms being recorded. Then the GP has advised that this could be a side effect of the yeah. Oh, that this could be a side effect of the continuous use of contraceptive. And the GP is advising vasectomy. I don't think it's vasectomy they mean. I guess maybe they mean, what's the other one for the vasectomy is for male, right?
Hysterectomy?
Yeah, he's hysterectomy. I think that's kind of what it meant. So I'm just kind of, I guess that's what those three questions are. Also, prolonged use of contraceptive leading to thinning wall of the menopause, thinning wall of the uterus. Is that causing menopausal symptoms? And in that case, is hysterectomy a resolving mitigation for that? Yeah. And if I didn't paraphrase that question well, please just rephrase it and type it in. But whoever wants to go between Dr. Degoke and Dr. Yamsi, that'd be good.
Yeah, I could take that one. Yeah. So contraception thinning the lining of the womb. Now, so there is a kind of a contraception, the intrauterine system Mirena coil. The way it works, so it is one of the reasons apart one of the its use effectiveness. One of the reasons we use it apart from contraception is that it stops heavy menstrual bleeding. So yes, it can thin down the lining of the womb. The lining of the womb is what sheds every month in every woman. Okay, so if you give progesterone, which is a hormone, it will thin that lining, which then means that there isn't anything to shed and that woman stops bleeding, full stop. But it doesn't cause any long-term sequelae or any long-term problems. So it's not, you should not, because of that, you don't go and have a hysterectomy. If your period stopped because you've got the Mirena that thin the lining of your womb, the moment you take the coil out, the lining will build again if your ovaries are still active. So what so sorry?
I'll drop it there and I don't.
So I think we need to mute someone, sorry. Yeah, sorry, Kaya.
Yeah. Okay, so you should not be, so that does not lead to any sort of negative problems or sequel in the past, and it's not a reason to go and have a hysterectomy because you've had contraception. No, it has nothing to do. They are completely different things. People who have a hysterectomy, there's a problem with their uterus, maybe because they've got heavy menstrual bleeding that is affecting their quality of life, or they've got disease in their uterus that needs to come out. Yeah, but no, so the contraception does not does not lead to having a hysterectomy.
So yeah, the other one I was flipping as well was, so is thinning of the wall of the uterus, could that be a symptoms of menopause?
So thinning of when you're, so like I said earlier, the lining of the womb is like a carpet and it builds up every month based on what the hormones are doing. So once that hormone cycle stops, once you don't have estrogen, you don't have progesterone, the lining will thin down naturally as a normal, and there will be no shedding of blood, but that's a normal like aging process. Well, I suppose a normal progression, if that makes sense.
Okay, thank you. There's one question I have here. It says, can I have advice and examples on how to start conversations with my partner about the symptoms I'm experiencing? Currently, what they're doing is they're ignoring my conversations, they're waiting it off, and they're supporting it off with prayers. So Why are you guys laughing?
Yeah. Yeah, it's a
Prayers answer all things.
yeah, it's a common problem for us, especially Nigerian Christians. Not only Nigerian Christians, but many of us. We over spiritualize things. And I please don't go away and thinking that I'm saying prayer is not important. Prayer is extremely important. But you also need to pray with understanding. You need to know what's going on. So to answer that person's question, it's an issue that is going to make or break your marriage. It's an issue that is affecting your life. And therefore, it's an issue that you need to find time to discuss. So if I'm having issues with erectile dysfunction, for example, I need to call my wife and say, look, I don't know what's going on with me, but this is what I'm feeling. This is the way I'm feeling. It's not that I don't want to be intimate with you. It's just that this is what I'm going through. And then we talk about it. We talk about it and discuss it. So if you are on this call today, for example, you can go back and say, look, I've listened to a talk and this is what they're saying. Could it be? Is there anything we can do to help me so that our marriage will be helped? That's the kind of approach I would take for it. It's to be open, it's to be honest, and also it brings some vulnerability. Again, like I said, men are usually very, very difficult to talk with things like this, but it's with your wife, it's not with an outsider. So, or the other way around. So we just need to be open, honest, transparent, and discuss it as an important issue, not just a side issue, not something you joke about. It's something that is serious, that is affecting you, and you want to look into how you can help each other.
I'll just come up with thank you. If you're just joining us, you've probably joined us midway. Please, if you want to ask questions, make use of the Slido link. The hashtag is Mr. and Mrs. And if you would prefer to ask your questions whilst here, use the hand raising option and you'll mute yourself. Okay. There's a question here. It says, can you get a prescription for testosterone? So I walk up to you guys one day, tell you guys I need a testosterone prescription. I fire up pharmacy and I inject myself. That's
I think
simple.
he said the question is,
on
can
women.
women?
Yeah, I was
I
gonna
know
say
that's what,
women.
yeah, I'm saying, can I,
You
can
said
a woman, yeah, can a
okay.
woman, well, Spooky, don't start that. I'm not trying to change anything here.
Yeah, so again, currently with the improved profile of menopause, use of testosterone in menopausal women, not everybody, but specifically for menopausal women that has issues with libido, for example. They are currently on HRT, they're taking HRT, and every other thing appear to be working, but they're still struggling with their level of libido. Those are the kind of people that we can prescribe testosterone for. You have to be careful with prescription of testosterone because there are strict license indication for them. And when I'm talking about license indication, that means the legal indication for prescribing it. And unless somebody meet those legal indications, you don't want to prescribe. So you can walk to me and say, I want testosterone, and I'll give it to you. I have to be sure that it's legally and the license is available for me to give you.
Okay.
Don't know if my sister wants to add to that.
Yes, absolutely spot on, Dr. Adekunle. Thank you. Yes, so yes, libido is the indication for which a woman can ask their GP for testosterone, but they need to be on HRT. They need to be on estrogen and progesterone if needed, and they have to be on a maximum dose of that first. And yeah, and it can easily be stopped if it's not helping. Usually after a period of a few months. Now, they can also, the other thing though, what people are tending to do now, we are fine, because some people, there's this general idea that testosterone helps with everything. It improves brain fog, it improves your performance, it just makes you feel better generally. The license is for libido, but people go and ask their GP because they feel confused or they have brain fog. But if they don't get it with their GP, if you go to the private sector, there is a particular testosterone that is licensed for women. So they might be able to get it easier from the private sector. Obviously, they are paying, so it's there. But on an NHS GP will not just give you for that. They only give you if you have libido problems.
Yeah. Thank you. Thank you. And there's one question I've got in here. It says, instead of HRT medication, I don't know I don't think I have it. Instead of HRT medication, can acupuncture be an alternative therapy?
And if I think the person is saying they don't want to use HRT because they think it causes cancer.
Oh, yeah, okay, I get it.
So instead of that, can they do acupuncture?
Yeah. Go ahead. Sorry.
Yes. It's one of the alternatives. So there's a whole list of other treatment options that we call alternatives to HRT. Acupuncture is one of them. The evidence is not very strong that it was, but it's there, and people can go and try. If you know somebody, the Chinese people who offer these things, there are a lot of other things that people can use that can try. So it's your lifestyle, your exercise, your weight loss, if you're somebody that has a little bit of alcohol and you have hot flushing, alcohol can fuel that. So we'll suggest that you stop that. So again, exercise can also help your natural happy hormones if you're feeling mood swings. So that's quite a good one. Then there are other tablets as well. There are antidepressants that people can use if they're struggling with their moods, and certain tablets too that help with the hot flushes, which are in the antidepressant category, or in the what we call the painkiller category, the kind of painkiller that you can use as well, that can help with symptoms of the menopause. Currently, there's another medication that's literally just come out of the press, that will be coming. It's gonna be released in this year for women who have had breast cancer. For women basically who cannot have HRT. Is a new, completely different class of drugs that you can take orally. So yes, there are things that are available.
Yeah, all I just wanted to add to, because they put in bracket, I don't know if this causes cancer. It's something that has impeded the use of HRT over the years because of the association with cancer. And that's why not everybody can get HRT. Sister just mentioned that if you have breast cancer, for example, or a strong family history of breast cancer, we try not to get you on HRT. However, there are a lot of studies that have been done. Yeah, HRT can still cause, if you don't take it in a proper and appropriate way, then it can still lead to cancer. For example, somebody who still have their uterus, there are type of HRT they can take, there are type they can't take. Because if you taking estrogen only without any opposed progesterone action, then that can lead to cancer further down the line. But I think the medical community is well versed now in management of people with menopause and use of HRT, that I wouldn't be unduly worried about the effect of cancer if I need HRT, because the advantages that you get from HRT, it's massive.
Thank you very much. So we've got a hand up, but yeah, I was going to ask a question afterwards. Can you unmute yourself, Pastor Bioden, and ask your question?
Thank you so much, Mira.
Yeah.
And I want to thank Dr. Abel and Dr. Yemisi for your incisive and excellent contribution and help in this topic. Thank you so much. My question is this: what is the place of exercise, regular one, and also gymming in sustaining andropause and also in the increase of the level of testosterone in men? Is there any place? Thank you.
Yeah, thank you. I would say yes to anything that is related to exercise. The advantage of exercise is massive. It's just a lot of it. I don't think there's been any scientific paper that I read that link exercise directly to production of testosterone, because the body naturally will produce testosterone. It's what the body is made to do. He will produce it. But I think if you exercise, it will maintain that. It will give you some good effect if you and like I said earlier on, exercise have so much effect on other part of your life. It improves your mental health, it improves your cardiovascular health, it improves your gut health, it improves everything if you are the type that will exercise. The problem, maybe what we have had is that people who go to gym a lot do take testosterone exogenously. And that's why you can say, well, it's building their muscles, is doing that. But exercise on its own, I haven't come across any scientific paper that says, well, if you exercise, your testosterone level goes up.
Thank you, sir. So, I've been looking, so typically, I don't know if there's any research that shows the divorce rate or the separation rate caused by either andropausal symptoms or menopausal symptoms.
Yeah, there's a paper. There's a paper that
Okay.
yeah, there's a paper that was done in, I've forgotten. But there was a paper that linked the two.
Okay. So my question is, so I'm looking at a research data right now, and it's showing me the spike rate of divorce in the since record began, maybe since the 40s. And you can see an exponential growth as it continues to go high. But the question is, these symptoms, as we've talked about it, must have been happening way immemorial. People have been having these symptoms before. So how come our forefathers were not divorcing themselves because of andropausal and menopausal symptoms? You get, but now people, so I'm just throwing it open again. It's one of my devil's advocate questions. Say, why? Is this society? I know there might be other factors like societal awareness and all that, but why is this now becoming an issue and a threat to marriages when potentially, I don't have the scientific data, but maybe it wasn't so a couple of decades ago?
Yeah, well, you can extrapolate or use that same question to say, why is so many things that is happening in our world today is happening? Because we have modernized many things. Even we're trying to modernize God. And that's, for me, this is my answer, is because of the fact that when my mother was growing up, she wants to be with my dad because of me. 2, it's not acceptable if she doesn't stay in her husband's house. The society frown at it. So even if, and this is just even if my dad was terrible, my mom was still going to stay. That's not happening these days because everybody is their own master now, and it will be like, no, I can't stay, I need to go. And that's what's happening. I know that when I was growing up in Nigeria, if you are a divorcee, you cannot become a commissioner in the government. But these days, nobody bothers about things like that. Even in the church, we're advising people that, well, if you can't carry on, just go and leave. So it become, I think that is the reason. I don't think that the menopause and andropause issue is new. It's been there. But people have been coping, have been managing because of other reasons. But those reasons have been put out now, and everybody feel free to think about yourself. That's the common thing we hear now. Think about yourself and live your own life. You're not joined at the hip with anybody. So if it's not working, just go. I was chatting to young people recently, and they said, well, they were joking, but that joke was too expensive for me. When I was listening to it, it's like, well, I'll get married at 21, and by 26, if it doesn't work, I'll divorce. And somebody's telling me that at 16, 17, that's what they are planning. So you can see where we're going.
Yeah, thank you. Any more contributions? I've got one online. I don't know. They said probably that's why they went down the polygamy route.
Yeah, that was true. That was true.
That could have something. Okay.
Yeah, sorry, there's a question here because I'm mindful of time that we've not answered. They said, what are alternatives for women to make a living when structured work is too hard to cope with during menopause?
Right, Sister Amy, see that's for you.
That's well. That's I think that's a question that even Pastor T can answer. Yeah. So yeah. So if you can't stay in work, like I said, I've personally seen women who resigned. So it was a teacher, but she was distressed by her symptoms, so she basically left her job. Obviously, if you are financially empowered to leave your job because of your symptoms, that's fine. Maybe you're in a relationship that you've done this, or this, what they call this, you've engaged in in multiple in things that give you multiple streams of income based on what you know, your background, your training, and all of that. That's fine. So it depends on, so I did say something during the talk that sometimes when you get to that point, it might be good to look at things that you've always wanted to do, but you've never been able to do. You can start a new career. It doesn't matter if that your present career is not working for you. You can look at a new career, something that you just enjoy doing, because and you that you can monetize. So you know become self-employed. If you're somebody that likes to cater, you can start doing that as long as something you think you can manage. You know, you can, if it's any new thing, any new career. Yes. So I think that's something that you will decide whether you want to do. But if you don't have the financial, I suppose, buoyancy to leave your job and you're suffering from symptoms, then I suppose it's something that you might need to maybe discuss with your manager, maybe your GP, take some time off work. That might help, because sometimes all of these things that you can, if you sort of get some management or take some time off, things tend to self-correct, and you may not necessarily need to leave your job. So I think there are different ways that you can approach it, really. Does that make sense? Thank you.
All right. Thank you. I have someone.
Sorry, one more thing to that question. Someone said, is menopause so bad? The person just sent me a private chat.
But
No.
like I said earlier,
No.
25% of women will have menopause as a walk in the park. It will be nothing for them. They won't have any symptoms. They'll be fine. Another 25% will have severe symptoms, in that they might really, really suffer. And this is just sort of, they're random, not just as a rule, you know, it's just as a guide, really. You know, and they will suffer symptoms really, really badly, especially suicidality. That has been seen in the perimenopausal. But I did say earlier on that people who've had maybe postnatal depression or previous mental health problems are more likely to have like severe forms of that when their hormones begin to change. Remember, it's your hormones that are changing and how your body is reacting to all of this. And there's some other women who'll be like, well, I have some hot flushes, but I can live with it. It's fine. So they have symptoms, but they can manage. Some don't have symptoms. And there'll be some people who'll be like, okay, I'm not suicidal. It's not that bad. But, you know, I want to be able to move. more productive at my work. So I definitely do need something. So it depends on how you're feeling. And that's why they keep saying that the mantra is that it's to be so individualized. It's down to you. If you can't talk to your GPs about you, about your personal circumstances, your symptoms, your medical history, and putting everything together to work out what will work better for you based on your own preferences. So it's not all doom and gloom. No. And it's a phase, and it does tend to stop after a few years. Some people 6, some people 10 years.
Can I just tell a joke of a doctor, a lady doctor, and it's a joke, but it's a real story. It's what happened. A patient went to see a lady doctor because of menopausal symptoms. But as soon as she entered into the doctor's office, the doctor opened the window, put on the fan, and then closed the window, opened the fan, and within that 10-15 minutes, she's done so many things about hot flushes for herself, to the point that the woman said, actually, I think yours is worse than mine. I have to go and look for another doctor now, or something like that. So it's individual. It's for some people, it's not a problem. For some people, it comes with all sorts of other issues. I think why it's been emphasized today and always is that so that you are aware. You don't blame something else when what you are having is a physiological changes to you that need extra support for you.
Oh, thank you so much.
And I just mention one other thing, and it's also the socioeconomic impact. There's a huge amount of population of women in work, and I was saying earlier that some women, that's when they are the CEO. That's when they're the top person. They've been in their career for 20, 30 years. They don't want to just let them just slide just because they were hot and sweaty and they couldn't really manage a meeting. No, they just need understanding and support that, okay, it's a moment, it's fine, they're all right, they will come out of it. And so they can keep people in work, because at the end of the day, work is good for your mental health, it's good for the government, it's good for us all, rather than people taking early to retirement and then they go home. There are a lot of negative things from not staying in work. So it's good to keep people in work. Thanks.
I think the sound has got a hand up. Omotara, do you want to unmute yourself and speak? Okay, maybe that's a legacy and okay. All right, that's fine. Okay. I'm just thinking, trying to flip through the other question.
Okay, I'll just sorry.
No, I think
someone sent me a private chat.
Okay, that's fine. Ask that.
It's more, I don't know if it's a question, but I would read the both of it. Said a long time use of contraceptive for women can make the ovaries quiet and get smaller in size. Could this not affect the onset of menopause?
So I've not seen any sort of evidence to suggest that is the case.
Okay.
And in terms of shrinking the size of the ovaries, I've not seen any paper that has said that, and I don't think that is the case at all. It's just, it changes what happens with your ovaries is that normally if you're not on hormones, you have a cyclical thing that goes on every month. Your progesterone, estrogen is controlled. You have a bleed period. When you have hormones given to you for contraception, it just quietens that cycle. And once you remove the contraception, the cycle wakes up again. So yeah, so it doesn't tend to make people go to menopause early if they weren't going to go to menopause early anyway, based on their genetics or based on whether they've had some kind of physical problem or if they've had surgery. So yeah, so it's not an issue.
Thank you. And I'll add to that, there's another question that I think we missed. Can hysterectomy affect menopause?
So depending on the kind of surgery that you had, yes. If you had what we call a total abdominal hysterectomy, leaving your ovaries behind, then you should be all right. You won't have periods, but like I said, the ovaries are the primary factory for your estrogen. You've just removed the uterus. So if you remove the uterus, you don't have periods. But if you leave the ovaries behind, they continue to produce. There's obviously your ovaries produce a bit of testosterone. They produce estrogen. So you shouldn't be plunged into the menopause if your ovaries are left behind. But if your ovaries are taken out with the uterus because for whatever reason, maybe there was a cyst and they don't want to leave your ovaries behind, that person will be plunged into the menopause. All of a sudden, their estrogen, progesterone, and testosterone will cease. And those sort of people need to go on HRT. Yeah, definitely. And that's what is happening now. People, the surgeons are advocating for, you've had a total hysterectomy with uterus removed, get HRT plus testosterone as you're going out of hospital. So it can, depending on the kind of surgery. Some people, though, even if they've not had their ovaries removed, if for whatever reason the blood supply to the ovaries was compromised during the surgery, it can affect how the ovaries are functioning. So they might have some kind of early menopause, if that makes sense. So the answer is
All
yes.
right. Thank you.
Yes and no.
Thank you. So there's been a question. There's been one comment online around people probably much older people who are probably parents and or using herbal medicines and what that's because I'm just saying what are your thoughts on that? It might fall into your alternative bucket of what people could use, but I know these days on Instagram, at least if you spend 5 days, they will advertise one of these things to you in one shape or form. What's your take around the impact of these herbal remedies, and could they also be a source of solution or relief?
So yes, there are herbal remedies out there. Now they're like to make things simple, they're like estrogen type hormones, if that well, estrogen type products. So your we call them isoflavone. So your soya, for example, has a little bit of estrogen. It's not like what is in HRT. And if you think of what is in HRT, is estrogen, isn't it? Estrogen is actually what tends to treat the symptoms of the menopause. Progesterone is just to combat the side effects or to prevent the estrogen from giving somebody cancer. So you need estrogen. So any kind of herbal remedy that can provide some kind of estrogen, no matter how small, might help symptoms. Some women in China, they find because they eat a lot of soya, there's some evidence to suggest that they don't suffer symptoms as much as the women here in the UK. And that's probably because of their diet. So yes, there are these herbal remedies that have estrogen type properties that might help. But the thing about them is they're not regulated. People then turn them into drugs, but there's no regulation. We don't know how it can affect your liver or other medications you might be taking. The evidence for them is not very strong. There's no huge scientific evidence, so we don't necessarily recommend them. But people go and try them. And people in the alternative, in the what do they call these people? Homeopathic medicine world will advocate some of these things. But just be careful that if you're going to try anything here, but just make sure it's got the Holland and Barrett thing on it, because that's one that is sort of certified okay and probably safe, rather than having all sorts of things off Amazon or some unregulated products that nobody knows what they can do to you. But there's a place for them.
Okay, I think Pastor, I'll ask one final question and I'll hand over to you if that's okay. But the question was, so to you both, which food has testosterone and estrogen so that we can be eating it? Which food? Because they say that all the drugs, there's some sort of element of, so which food combination can we combine that will give us testosterone and estrogen and progesterone?
Why are not serious?
Well, I know about yam
You see?
having
Okay.
estrogen component to it. There have been hypotheses that probably that's why
Ondo people.
for those people who lived and grew up in Nigeria, our parents don't really have much of these symptoms. That's something that I know. I'm not aware of anything specifically for testosterone, to be honest.
Okay. I think Sister mentioned soya the other time. So yeah. Yam and soya.
Yeah,
Go
yam
on.
and soya. Yeah, there's some other herbal things. Like there's something they call red clover. There's something called black cohosh. But these are like herbal. They're kind of leaves. They're herbs. You've probably find them in Holland and Barrett, or you might have them off the shelf anywhere. But again, just be careful about these things. I don't tend to recommend them because we don't have. They're not regulated as such, and we don't have the evidence there. There are no papers to back them up to say that they are safe and they can interact with other medications if you're on them.
Yeah, we seem to have had two more questions come up, and I'll probably run through them pretty quickly. It says, can I have menopausal symptoms and like Dr. UMC said, the eggs are finished, but all of a sudden I start to have eggs again. Can menopause be reversed? Okay, yeah.
So, like I said, there's a finite number of eggs that a woman has, and they finish after a while. After they will just shrivel over a period of 50 to 55 years and just finish, basically. So if your eggs have completely gone and you stop bleeding, there's no eggs, then scientifically, I don't know about how your eggs can just suddenly come back now, but there are supernatural things I don't know. Obviously, that cannot explain, but that they will suddenly come back, no. Now, what tends to also happen is some people, I know people have said, oh, people got pregnant naturally after their periods seem to have stopped. Now, because the number of eggs continues to reduce and reduce and reduce, sometimes there might just be one final one, two final ones that can just release, and can fertilize. So that is also something that can happen, even if that woman has sort of reached that menopause. So they might, so that can happen. But once they've ended, like it's finished, then I don't know of any process that can bring eggs back to the ovary, because they shrivel and they are not viable anymore. And even if there is a sperm comes around, it doesn't have the genetic apparatus to become a child, if that makes sense. And this is science. This is science.
I think the last question is vasectomy, is this safe and reversible?
Yeah, vasectomy is safe. Theoretically, yeah, it's reversible, but it's supposed to be a permanent method of contraception. So that's why I said theoretically it is reversible, but the chances of reversibility is very low. And if you have vasectomy, to reverse it on NHS, there are very, very strict conditions, which many people will meet. So my advice, what I tell people if they want vasectomy, is to go away and think about it, pray about it, make up their mind, and treat it as if it's not reversible. Because technically they can put the vas deferens together, but how much of it will lead to being able to impregnate somebody, it's very, very, very low. It's a very low percentage. And it's an expensive surgery to do if you don't qualify for it on NHS. But the procedure itself is safe. It's a 15-20 minute procedure done normally under local anesthetics. So
there's one last one I had here online, which says, I think they're saying, could the number of children and pregnancies shown as being true, could that speed up menopausal symptoms?
No, not necessarily.
No.
You can have 100 children if you like. It will make you become menopausal quickly.
All right, Pastor, I'm gonna hand over to you. I think we've done some justice to the questions here. If you've got any, please feel free to ask. If not, raise up your hand and unmute yourself. And
Thank you very much, Olu. I think because of our time, we might not be taking any more questions. But if you have questions, you can send an email, and we would ask Dr. Adegoke and Dr. Adeniji to help us. But before we round off, I'll hand over to Remy for the announcement before we round up. Thank you, everybody, once again for your time.
Okay, thank you. Thank you, Statolu. I will just make it quick. We have quite a number of announcements. So next, just like we've had our Mr. and Mrs. series, today we have our breakfast meeting every first Saturday of the month. So the next one coming up will be 2nd of March. It's for ladies. Men, it's not for you, but you can listen in, so you can also be blessed if you are there in the background. But it's majorly for ladies. And we send out the Zoom link and you can join in. Please register, put your details in, because with those details, you'll be able to receive a feedback, the recording for the session. And it's always useful to go back to it. So at the back of what we've had today, we have a YouTube channel, and I'm sending out the link now in the chat for Mr. and Mrs. series. So if you want to go back on all the Mr. and Mrs. series, most of the Mr. and Mrs. series we've had in the past. Oh, thank you. Please visit that. We also have a link for the one for our breakfast, normal breakfast series, which is not the Mr. and Mrs. Like the one we'll be having next month. I'll share that. If you would like to revisit those series, please follow that. Women on assignment, we are that, just like the name says, we're just a group of women that come together to pull out that God-given vision, the mandate that God has given us for each and every one of us to have fulfill our vision and assignments that God has placed in our hearts. And it's just to foster that and to strengthen that vision so that we are kingdom ready. So please, and there are so many ways. If you have been blessed today, or you have this shared need to give or to support this mandate, please, you can, if you want to give your time, if you want to give your expertise, please reach out to us. We can reach out to Pastor Tolu or myself or Buki, and we will be able to find ways of giving. Also, we have a bank account if you want to support us financially. There's a lot of things that we're doing, and every little counts. So please, the account details are in the chat. You can just send whatever God places in your mind. It's always a difficult one to say, especially when it's just a group that is not that we just come together. But I think it's always important for us to understand that things need to be done, and we need to foster the kingdom of God boldly and financially. Okay, so we have this interesting thing coming up on June 28th to the 30th, and it's our ladies' weekend away. This is going to be the third structured version. We've had an unstructured one before that, and it has always been a blessing. This year, we're having a ladies' weekend away from the 28th of June to the 30th at Stratfordshire. It's going to be in Youngfield Park, Midlands. So this year, we're not staying down south, we're moving up north, which is really good. Not really north, but somewhere in the middle. And we have our registration link open. We are having an early bird registration, so please, we're giving a 10% discount for those of us that register early. For the 2 days, it's £300. You can see that where you go. Thank you, Pastor Tolu. So please follow the link, register, use the code. Just ask about it. If you want to come for 2 days or 1 day, or you want to be a day attendee, please use the code when you're checking out. At the early board, the discount code is valid until the end of February. Now, what it means is it doesn't mean you have to pay the full money before then. It just means register your interest, and you are to pay a minimum of £50 before the end of February, just for planning sake, and it's good for accountability, for us to be able to put things together properly. The registration is still open after February, so it's not like it's going to close. It's just that offer is closing the end of February. I will encourage us, make up your mind, invite your friends. It's always a blessing. It's not a structured church event. It's a lovely event where you can come together as women to just release ourselves in the presence of God, equip ourselves, and we always come back straight. So it's a good holiday also. The venue has lots of it has a swimming pool, it has a sauna, it has open ground to just relax. So if you really want to have a deserved holiday, please come around in the presence of God. I've also mentioned, written out here that I've mentioned the recording. We have that next Mr. and Mrs. session is coming up in May. So you can add that to your calendar. It's the first weekend in May. But we will be having our breakfast meeting, a women on assignment breakfast meeting, still coming up every first Saturday of the month. Also, at the back of the ladies' weekend away, if you have made up your mind to come, I would like you to please let us know, because we are trying to organize a coach to bring everybody, whoever is interested, but we need the numbers. So please, can you just send us a line? You can put it in the chat. You can send a private message to Women on Assignment or Pastor Tolu or myself to say, I'd like to come and I'm interested in going with the coach. Or when you're registering online, we've put a rough amount of what we think it will cost. It's like £96, but it can reduce if we have more people. So please make sure you let us know if you're going to be coming. I think that's the assignment and announcement from me. Anything I'm missing, Pastor Tolu?
Thank you very much, Remy. Yeah, it's also the WhatsApp group, but that is just for women. So if you want to join the WhatsApp group, that also helps us to disseminate information. And thank you very much, Remy. Thank you, Dr. Abel and Dr. Yemisi. Really appreciate you. And we'll be closing up in prayer. And I want to ask Pastor Biodo Alonge to please pray for us. I want to say a big thank you to him for his support all the time. God bless you. Pastor Biodo, please.
Thank you so much, everybody. I want to thank the doctors that took us in this exciting topic. Dr. Ebe Adegoke, God bless you, sir. The Lord will continue to uphold you and strengthen you. And Dr. Yemisi, nice to see your face. God bless you, looking amazing as ever. God bless you. Also, I want to also thank our moderators. They've been doing your man and your woman's job. Brother Olu and Sister Buki and Sister Remy, God bless you so much. Finally, I would also like to thank everyone online for coming online. I saw, I've seen people that have been online repeatedly on Mr. and Mrs. program. The Lord bless you for your time, and God Almighty Father will also divinely enrich you in the name of Jesus. Can we please pray? Father, we just want to appreciate you this morning. We thank you, Lord Almighty Father, for this vision. Lord, we appreciate you, God, for your mercies and your loving kindness. We thank you, Lord Almighty Father, for giving us this topic at this time. We thank you because you are the one that knows the end from the beginning. Ancient of days, we commit all that we have learned this morning to your hands, oh God, that you please help us to put them into use in the name of Jesus. Amen. We pray, oh God Almighty Father, is there anyone having issue of menopause or andropause? We ask, oh God, for divine instruction in the name of the Lord Jesus Christ of Nazareth. We ask, oh God, that you please encourage them. We ask, oh God Almighty Father, that you will support them. We ask, oh God Almighty Father, that Lord, you cause them to go through this, oh God, successfully in the name of the Lord Jesus Christ of Nazareth. Father, we pray, oh God, in your kingdom, that none of us will be found wanting in Jesus' name. We give you the praise, oh God. Take absolute control, Lord. In Jesus' precious name we are prayed.
Amen. Amen. Thank you very much. Thank you, everybody. God bless you. Have a wonderful weekend. Thank you.
Thank you so much. Thank you. Thank you, Dr. Adegoke. Thank you. Bye-bye.
Thank you. Please, the stewards, if you can wait behind, that would be appreciated. Thank you. Praise the Lord. Thank you, ladies. Quick one. Thank you, Uncle Olu. God bless you abundantly.
Yeah, thank you.
Yeah, you can leave now. Thank you very much.
Okay, is this time for me to go?
Yeah, but you can wait. You can wait. You're welcome to.
What if I've been taking
testosterone? Odeni.
What if I've been taking testosterone? People are discriminating. This is
Oh yeah, stay. Oh yeah, stay.
This is
stay.
gender
No
discrimination.
stay.
I'm done. Thank you, Eshe. Bye bye.
Thank you very much for your help.
Yeah, hero.
Who's that?
Today. Your head now.
You see, he's been taking testosterone.
I've written down the food, all those supplements. I will take them.
But you know the yam thing, I told my husband before, that yam one. And that's why I think
yam is not expensive, but everything that is good is
that's why people have twins now. Maybe that's why they say
now,
yam.
that's why they have a lot
twins.
of twins. Anyway, let's be mindful of time. Thank you very much, ladies.
Thank you. Bye.
Uncle Miwa and Uncle Tunde, please excuse us. Thank you very much.
I'm beside my wife anyway, so.
No, don't be beside your wife. Go and use your headphone.
No, she can excuse me.
Sorry, I didn't stop the meeting when I went off. Okay, that's fine. Yeah.
Don't stop it. Just leave yourself. Don't end.
All right.
God bless you. Thank you, ladies. Thank you. Remy, over to you, please.
Okay. Well, what do I do it now?
Do something else.
So we have
while you get ready, let me just a word of prayer.
Okay,
Sister Oma, please pray for us. 2 minutes.
No, I haven't.
Me, I stopped recording, but I don't know.